It was not easy to talk to my partner about it. I was in constant pain during our intimate moments. I always had a feeling in the back of my mind, a niggling question about my femininity, a doubt if I will ever become a mother. I was suffering with vaginismus. So what is vaginismus? Vaginismus is a condition in which vaginal spasms occur and prevent penetration during sexual intercourse. Several types of vaginismus have been described. The most frequently described in the literature are primary vaginismus and secondary vaginismus. In the case of primary vaginismus, it is impossible to introduce anything at any time into the vagina. Secondary vaginismus, on the other hand, occurs after a normal sex life with vaginal penetration. It is often triggered by a traumatic event in relation to the private area. Historically, the term vaginismus was originally used in 1862 by Dr. Marion Sims to describe a reflex-like contraction of the muscles of the vagina. This involuntary spastic contraction is a reflex response that is stimulated by imagined, anticipated, or real attempts at vaginal penetration. In severe cases of vaginismus, sometimes even the thigh and back muscles also join this reflex action. Vaginismus is considered a true psychosomatic entity. If we talk about the prevalence of this condition, research suggests that the frequency in the general population is estimated at about 1% among women of childbearing age. However, it may vary from 6% to 15% according to sexology consultants. There is a general difficulty to identify the true number. The medical differentiation between vaginismus and dyspareunia was effective only by 2005 in the Anglophone world. Moreover, it is still being considered a taboo, and affected women do not easily come forward with their complaint and may tend to avoid consulting a gynecologist. About 19% of women with sexual disorders would consult their gynecologist for this reason. Despite their pain and struggle, women with vaginismus show an increasing desire for having children, and they aim to become pregnant either by assistance or spontaneously. During pregnancy, prenatal care visits often represent the first gynecological consultations in these women. Some studies suggest that vaginismus has been reported to be the cause of 84% of unconsummated marriages. 30 years ago, one gynecologist found that 4 to 5% of married women in his practice had an intact hymen several months into the marriage. In clinical settings, secondary vaginismus often accounts for over 50% of women with pain during sex. Assessment. In the first instance, physical problems are usually identified by reviewing individuals and couple factors, and then confirmed by the physical examination. 3 physical problems that require special mention are pelvic congestion varicosities, vulvodynia, and residual ovarian syndrome. All these problems are ill-defined, difficult to diagnose, and difficult to treat adequately, and we will try to explain these in more detail in future videos. The prime difficulty in assessing these conditions relates to the subjective nature of pain and isolation from intrapersonal and interpersonal issues. These conditions sometimes come full circle to the interface between a psychic and somatic problem. That would be all for now, as vaginismus is a big topic. We have hence decided to divide it into 2 parts. In the next part, we will talk about the treatment, so do subscribe to our channel. Until then, take care, and thank you for watching.